It's linking up to go live.
But your internet is a bit.
Auzubillahi minash shaitani rajim. Bismillahir rahmanir rahim. Alhamdulillahi rabbil alamin. All praises are due to Allah subhanahu wa ta'ala for sparing our lives since last week Sunday till today. We appreciate this as we know we have not done anything to that worth it. We appreciate Allah over everything. We appreciate Him over the gift of life, health, and every other thing that what it is being appreciated. So, without wasting our time today, we are having in the house an expert to talk to us on the ravaging virus, COVID-19. So we have Dr. Imran Muhazimbelo to talk to us on updates on COVID-19. Inshallah, let's be attentive, take our notes and pen and jot some things. May Almighty Allah subhanahu wa ta'ala make it a witness in our favor in this world and in the hereafter. So, Doctor, you have the stage now. Assalamu alaikum warahmatullahi wabarakatuh.
Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. We give thanks to Almighty Allah for making it possible for us to gather together this morning and to discuss the current health challenges that we are facing globally. We thank Allah that He has spared our life, and we pray that Allah should forgive and grant Al-Jannah Firdaus for all those who have suffered and in this infection. We also pray for the frontline health workers for Allah's protection on them and their family, and all of us globally, that Allah should give us the solution and assist us to come to the end of these health challenges in no distant time. Briefly, I know many of us, we have heard different talk on COVID-19, and that is the disease. And we have also heard about the coronavirus since it first broke out, perhaps globally or within Nigeria. So I will, in the next couple of minutes, share my thoughts on this subject, and I will end my talk with some take-home messages. So my discussion will follow a brief introduction, talking about the virus, I'll give us some data. I'll talk about how does the disease present, and what are the different management protocols, what are the public health issues, and of course the hope is that we'll be able to develop a vaccine trial, a vaccine that will be useful and that will be able to help us contain the virus. So by way of introduction, COVID-19 is a disease that got this nomenclature early this year, and because the first case was the first case was reported late last year. It was named by the group that normally named diseases as COVID-19, coronavirus infection disease 2019. And it's from the, the family of the virus called coronaviridae. And it is an RNA virus. There are different type of viruses. There is a DNA virus, there is RNA virus. And this is also an envelope virus. I will talk briefly about what that means. But I must say that the coronavirus has been with us as far back as 1931, where it was first isolated in humans, and then in 1960, when it was first isolated in human being. I mean, initially in animal, then human being. However, the one that is ravaging the world was first reported following clusters of infections that were noticed in a city called Wuhan in China. And there are a lot of stories around this. Some are conjectures, some are hearsay, some are rumor. But what is known is that it started from this city. Some have said that the virus was a biologically created virus. However, this has been evidently denied via a lot of molecular studies that traced the genetic makeup of this virus. And what has been said is that if it is indeed a genetically manufactured virus, that some of the characteristics that it's having, you will not have, and that they will have used the different genome sequencing to build the virus. So this has been denied. However, some also believe this is not true. So, but what is important is that this virus has been badly mismanaged with respect to how and where it has originated from. Because even though in the literature we are made to believe that the first case was in December, while preparing for this lecture, I also came across that it may have been reported earlier than December, for that two reasons: either it was not diagnosed on time or there is suppression of data. But the first, what is officially stated is that this virus was contracted from a poorly cooked local seafood, and it was believed that people that are using this market first contact of this virus. However, when the virus was initially in that city, everyone, I mean, the government of China made effort to contain the virus and ensure that it doesn't spread to other parts of the world. But with time, when the number of cases, which I will show briefly, was increasing, and it's becoming almost evident that it's going to cross border to other country, then the World Health Organization, being the official agency that monitor outbreaks globally, first said in January 30 that this infection is of public health emergency of international concerns. What this means is that countries of the world should be preparing, and that there is need for a coordinated international response. But unfortunately, this period, maybe because everybody is in the euphoria of a new year and what have you, uh, this was not this statement was not really taken seriously, because I can't remember any country in Africa uh, doing anything fantastic in the early part of this year, when in fact many cases were reported in Asia. However, 2 months down the line, the cases had skyrocketed, and there are multiple cases reported in different countries of the world. And this forced the World Health Organization to make another declaration on the 12th of March to say that this infection is now declared as a pandemic. That is, it is now global. So, but it's important for us to know, like I said at the beginning, that there are different group of these viruses, and that it has been with us for some time. For example, MERS, the Middle East Respiratory Syndrome infection that is also caused by coronavirus, has been with us, and it has only been limited to Asia and some part of North Africa. However, the coronavirus, which is otherwise known as the severe acute respiratory syndrome virus, SARS virus, um, was first isolated in December, and now from one case, it has gone into millions. So this is just to like a synopsis of how it happened. The first case was reported, first hospital admission was in December 16. Um, for about 2 weeks, when this case was being managed in the hospital, um, the government were thinking that, well, they'll be able to do something. And not until 31st of December before they took a public health intervention. That's about 2 weeks after. And what they noticed is that people are having pneumonia, they don't know the cause, and they are struggling to know what is the cause. However, the virus um was first isolated, like I said, early this year, January 7th January to be specific. And then, of course, the first genomic studies of the virus was released about 5 days later. And then, of course, um, after the virus was characterized, that is what is meant by genome release, in January, then it gives them the opportunity to know the characteristics of this virus, and then they started aggressive contact tracing in China, and that's when they discovered that it is not only being transmitted now from the animal for having contact with seafood materials or seafood, people that deals with seafood, but people that do not even have any history of going to that market were now having it. That is man to man, human to human transmission was confirmed by January 20. That means there was community transmission. And of course, they started the process of lockdown. And this lockdown involved restriction of transportation, restriction of people from having close contact with people, and of course, many hotels were also shut down, and schools. So, and that is how the event unfold before you can see that it took before the disease was fully characterized. It was almost about 3 months, and despite this infection keep on uh, kept on spreading right from inception. Now, if you look at this slide, you see that how the disease, the infection was the incidence, the number of new cases, how it was increasing. As of December uh, 29, there are only 5 cases of infection and 1 death. You can see that by January, it has increased to 571, and there are 17 deaths. And then as of 1 month later, um, almost a month, about 51,000 people have been affected, and more than 1,500 got out of hand. Now, this is just to let us see that I'm sure all of us have seen this either by way of jingle or the television, or those of us it is an envelope virus. It has a glycoprotein, this is the RNA, and this is the nucleoprotein, and then the membrane protein. I will explain this when I'm talking about the virus itself. Now, it's also important for us to note that, like I said, there are some intermediate hosts of the viral infection. And these intermediate hosts, there are different ones. There is a theory around bats, swine, civet, and mouse. The virus is known to attack, to get itself attached to angiotensin converting enzyme receptor. And that is one of the reasons why people with an underlying disease with hypertension, there's particularly those that are using ACE inhibitors, are often also affected. So when the virus usually is picked I will explain about the mode of transmission later. When it is picked, what happens is that the virus gets attached to this receptor, and people with underlying disease like hypertension, chronic obstructive lung diseases, like somebody that normally have continuous cough, either the person is asthmatic, has COPD, a chronic smoker, or somebody that has diabetes, because people that have diabetes, particularly those that are poorly controlled, have reduced immunity, and cardiovascular diseases, elderly people, and then of course people that have they have immune suppression. They are at higher risk of having uh, um, a severe form of this infection. Now, when this infection happens, what happens when the virus gets itself attached to the cells? What happens is that the body tends to react to this virus and produce some substances that we call cytokines. These are pro-inflammatory markers in response that the body sees this virus as foreign. So, and the body police system, if I may use that word, tend to attack the virus. And then as this inflammatory response is produced, in some people, this inflammatory response is exaggerated. And when it is exaggerated, that is what is called the cytokine storm. And what happens is that um, there is now disruption of the inflammatory, pro-inflammatory and anti-inflammatory factors. And therefore, what happens is that the body tend to, there is production of fluids because the vessels are open. And then, of course, there is also that these inflammatory markers tend to destroy the underlining of the vessels, causing excessive inflammation of these vessels. And these reaction tend to cause clotting of bloods. And because many of the organs have fine vessels that supply them, so these vessels, because there's clogging of the blood, so tend to be blocked. And when this happens, so that reduces, for example, oxygen supply to the lungs, and then you see that the person may be complaining of difficulty in breathing. Sometimes the body tends to react because of these changes that I described that is happening, and then the person may be coughing. But when the person is coughing, the cough will not bring out anything, like a dry cough. So, and for those that their body does not now have good defense system, like the uh, the um, the elderly people, what happens is that their immune system will not be able to mount an antibody response and to limit the extent of damage that this virus is causing in the body. And that is why they will now manifest a form of a severe disease. So, well, this is just showing the different type of intermediate host for the virus. Like I said, different type of coronavirus have different intermediate hosts. Now, evidence from Nigeria had shown that um, coronavirus is with us, and it is also showing that because we in Nigeria now, many institutions, particularly those that are supported by federal government, have been able to characterize the virus that we have in Nigeria. I got this report, I think, about 4 or 5 days ago from the African Center of Excellence and Genomics Infection at Redeemers University, where they were able to offer more information by characterizing the type of the circulating coronavirus that are in Nigeria. And from the analysis, it does shows that we are now having different variants of this coronavirus. And it is also showing from their analysis of their phylogenetic, um, their phylogenetic analysis, it's showing that there is now evidence of community transmission. Like I said at the beginning, community transmission suggests that this infection, you do not have to travel to China to have it. You do not have to travel to an isolation center before you have it. You can actually have it even without leaving your house. If somebody who has it comes in and to you or get exposed to you, then you can acquire. And I'll talk about how to prevent this. So these are some of the materials for any one of us that is interested to read more about it. Now, there is also a lot of argument as to how the infection is transmitted. I'm sure we'll have seen so many videos. What we know initially is that when somebody coughs or sneezes, the virus is released through droplets. And that's why we are asked to do physical distancing. However, um, current research, particularly those that are released in the last 4 or 5 weeks, is showing that coronavirus may also have an airborne transmission. Airborne transmission means that when somebody sneezes, there is a projectile of particles that comes out, and that sometimes um, if somebody sneezes on a paper, a plain sheet, you see droplets. But as you move away from the person that sneezes, the droplets may not get into the surface. However, the airborne transmission is saying that particles can be suspended in air for a long period of time. There are a lot of control studies that have been done where they created a scenario in a lab and they released substances, and they were looking at it for how long these substances can be suspended. There are different theories about it. Some are saying 8 hours, some are saying 4 hours, some are saying up to a day, and things like that. But now it is now known that coronavirus can be transmitted by airborne. And that means when they say something is airborne, that means if you are walking on the corridor, let's say, for example, if you are in an enclosure, say, for example, you go to a, you go to an office where there's an air condition there, and somebody who is carrying the virus but does not have the symptoms sneezes before you enter that room. But when you enter, you can still sniff in this virus. That's what he's saying, because you may not have been there when the person sneezes. And so, although initially this created a lot of back and forth between the World Health Organization and other scientists, but many scientists believe that the virus is airborne because there are so many people that when they were doing the contact tracing did not have direct contact with anyone, and they are still coming down with the evidence of this disease. So when I'm talking about public health prevention, I will talk about how to minimize the risk of acquiring this infection from airborne. Now, this is a familiar slide that was produced by the Federal Ministry of Health Nigeria, supported by the UNICEF, that the commonest symptom is fever. Some will have difficulty in breathing or cough. But the one um, uh, that is common, yes, particularly in Nigeria, is that well, if anybody have fever in Nigeria, before Corona, every Nigeria will say, oh, it's malaria. At best, they may, as another differential diagnosis, they may say, okay, maybe a flu. But we now know that if anybody has fever, that is temperature that is more than 37.2, we have to think about coronavirus. And this has worked based on my experience. I've had people close to me who had said, oh, they have malaria, they've treated it, and blah, 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 and they're okay now. And then you just jokingly advise them that, have you done COVID test? Say, no, they have not done it, but they're okay. But go and try it. And then they will go and do the results, they'll go and do the test, and then they become positive. Now, those type of people, they may have cleared the virus. They may have cleared the virus themselves. They, they may have, I mean, they could have cleared the virus themselves. However, if they have the virus and they don't know they have the virus, they may not be taking conscious effort to prevent themselves from transmitting this virus to other people. And that's why now, if anybody has fever Yes, you should treat yourself for malaria, but please try and quickly do a soul search and see whether you have exposed yourself. And if you are not sure, government has provided many spots for testing. You walk in there, it is not it is not a death sentence. Go for testing and then be sure. If they tell you that you are negative, then your mind is at rest rather than having an unsure mind. And these are some of the telephone lines that. So these are other. You can see here that most of the symptoms of this virus are common symptoms that we have in Nigeria. Fever, fatigue. Many of us, when we are tired, we get home, okay, go and take some water or go and have some shower and rest. If anybody has dry cough, we go and buy cough mixture and things like that. These are some of the things we do before. But we now know that if anybody has that now, we need to do more. And based on what I've explained with respect to how the virus causes damage to our organs in the body, because of the inflammation that happens, excessive inflammation that happens in the vessels, so that causes clotting of the blood. So this affects most of the organs in the body. There's virtually no organ, including our brain. There are instances where people that have coronavirus will come down with confusion. Sometimes they will be having diarrhea. Sometimes they will have abdominal pain. They will have runny nose that has refused to go despite all the all the medications that you use. But I must say that out of every 10 people who have coronavirus, 8 of them will not have any symptoms. And it is only about 10% of them that will have severe problem that may warrant hospital admission. And about half of that might need some form of oxygen support. And then about half of that again may need machine that help people to breathe, which is what we call mechanical ventilator. So it is something that we need to take seriously. And the fact that some people are having it and they are getting away with it does not mean um, others will get away with it. Now, this is at risk people. I want to emphasize this because in our own culture here, we will see that we run a communal um, system where our parents sometimes stay with us, or we go and visit our parents or our uncles who are more than 60 years. So these people have higher risk of having manifesting severe infection. Anybody that has chronic medical problems, I've said this, hypertension, diabetes, cancers, or anybody that is on chemotherapy, drugs that are used to kill cancer. This also affects the white blood cells in your system. And these white blood cells are primarily the police of the body. So if anybody is taking drugs like this, may also predispose, or anybody that has a background history of obstructive airway disease, like I mentioned. However, let me say that there are a lot of young people that are coming down with severe form of this infection, and they cannot be explained why they are coming down with severe form. And that is the scary part. Because assuming it has just been a straightforward division to say it's a disease of the elderly. Like we say, if it's a disease of the elderly, then we know that the young people are the ones that alone that we have to talk to. That that will be. But we are seeing young people 30, 25, although not very common, but it's happening. That many of them also died. Why? And they do not have a background medical problem, although very uncommon, like I said, but it does happen. And when it happens, it's 100% uh, um, complication to that family. So whether because it is rare, we should not um, jettison it. So the lesson here is that we should not have this sense, false sense of security that yes, if I have it, um, 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 I'm unlikely because I'm less than 60. So, so all we should do is to take responsibility. Now, the other issue I also want that is also important for me to emphasize is that is it if someone has the infection, can you also have a second way, a second exposure to that infection? The answer is yes. There has been documented, this has been documented in the literature. What is expected normally is that when you have an infection, you are supposed to produce an antibody. And when this antibody is produced, it's also sensitized some cells in your body that we call memory cells. That when you are exposed to that infection again, what happens is that because your body has fought that infection in the past, will be better prepared to fight it this time around. However, it has been shown that some people may not develop antibody, even though they've had infection, they've cleared it, and they are supposed to develop antibody to fight future exposure. But some people do not develop antibody. And so that is another danger. And that's why, for those of us that listen to international news, you'll be hearing about the possibility of second wave of infection. Second wave of infection. That second wave of infection is being discussed in the context of individual, is also being discussed in the context of population level. Meaning that, yes, if you flatten your curve, flattening of the curve means if you make the risk of having new infection to be static or coming down, uh, there is a possibility that the infection might rise again. So that is that. And then, of course, like I mentioned, so how long this antibody lasts in the body is also a subject of controversy. Different research been have shown that some people have detectable level of antibody to fight uh, future exposure to this virus for 3 months, some 6 months, but some nothing, and they have had the virus. So that means they are at risk of a second exposure. Now, it is not only the clinical manifestation that happens. If you have anyone that has had this virus, we can ask, particularly even those that have mild infection. We have heard different stories on the radio, on the television. You see someone come down with, well, maybe they are doing screening for people who they think they are at risk of having the infection. Maybe they've had contact with somebody, and somebody will just go forward and say, "Oh, I don't think I have it. I'm very strong. I just jogged this morning, or I just play football. I just did this. I just did that." And the result comes back that you are positive. The first thing is that, in fact, in between collection of sample and telling you the result is an anxious moment. Some people are very anxious, jittery. They are not able to do anything again. We have different level of level of resilience in terms of being able to accept negative information. Some will manifest it, they will not be able to sleep, they will not be able to eat when they are told that maybe they are positive for the virus, because they don't know whether the virus will run an aggressive course in them or it will be a mild course. And for those that has severe disease, some of them come down with depression. So when they see them giving them oxygen, rushing fluid, they are not able to eat. Some of them they will pass tube into their chest and things like that. So some of them can come down with depression. And when they come down with depression, depression is also very difficult to treat. Um, and some may manifest what we call psychosomatic disorders. Anything that happens to them, they will link it to corona. Anything that happens to them, they will link it to. If they cannot go, if they cannot empty their bowel in the toilet, it's corona. If they so, and that could create more problem for them, because when they are anxious, this will affect their whole system and they will not function optimally. And then for those that had the virus, maybe treated, had some symptoms, they may have what we call post-traumatic stress disorder. Post-traumatic stress disorder, from the word, is that they begin to have flashes of how they had near miss. Say, for example, if somebody desaturated, maybe the way the person presents his own case is that he had sudden struggle to breathe, and he or she is rushed to the hospital, and he sees how narrowly he escaped the virus. And meanwhile, maybe on his bed or her bed beside her, she could see people dying and their corpse being moved away. So that may create a negative impression in people's mind, and it may affect their their functionality, that they may also need to go and see a psychologist or a psychiatric um, doctor, who will have to treat that as a complication of the virus. Now, this is like the global dashboard as of 18th of July, yesterday, 5 p.m. There are about 13,876,441 confirmed cases of COVID, and more than half a million, 593 and 87 deaths have been reported, with the highest in the US and Brazil. Um, but in Nigeria, as of that yesterday, Nigeria had about 35,454 confirmed cases. We can always go to WHO and look at the global dashboard per hour, and about 772 deaths. So bringing case fatality rates all over the world to between 1 to 5%. That is on the average. But of course, as if you now calculate this case fatality rate per age group, it is highest in the older age group. Now, how is this infection diagnosed? The first thing that is done is that if somebody manifests symptoms, it is easy. Somebody is having fever, headache, coughing, and presents into the hospital, then they will recommend that, okay, let's do test. And this test could be the swab that is done at the virology lab or molecular lab, or sometimes they use radiological evidence to also buttress the diagnosis. Now, for others who are asymptomatic, they are usually picked either by doing a risk assessment or contact tracing. If somebody is confirmed to have coronavirus infection, what the person is told is that in the last, because of the incubation period of this virus that is between 2 to 3 weeks, the person is asked to list people that he has had contact with for more than 15 minutes. People that he has had contact with for more than 15 minutes in the last 2 weeks. So, and that's why it is a very, very big issue if we have to make effort to reduce the burden of this virus. So, and here I must emphasize that any one of us that has this infection, like I said, it is not an infection that one will think that, oh, I had it because I did something that is terrible. No. So don't have guilt, and because of that, denied the healthcare provider relevant information. For example, if they ask you, where did you go to? You should mention every places you went to, including names of people. But some of us, oh, because the person is brought to the hospital, maybe the husband was brought to the hospital by the wife, and then the man also visited another woman in her office, maybe for professional reason, but he didn't want to mention that woman's name so that the wife will not get angry. He now is hiding that information. And he may have spent more time with that lady. Maybe they have a professional meeting or whatever. If you hide one of your contacts, you are endangering the life of that person and the life of other people who have had contact with that person. So it is a huge problem. And that's why we need to be honest with the contact tracing. I'm emphasizing this because that is where community transmission starts. You see somebody, they will pick somebody, oh, you have this virus. Who are your people, people that you have visited in the last 14 days? You see somebody writing 3, 4 names. It's not possible. Are you saying you have not gone to the market? Are you saying, sorry, are you saying you have not talked to any of your family member? What about other people's houses that you have gone to? So you need to list all the people that you have had contact. Now, this contact, the surveillance team will describe it, that you must have spent some time. And then they will also ask you questions. When you are with this person, were you using face mask? Was the person also using face mask? Did you keep a distance between yourself, or you are together? Were you in an enclosure or in an open field? Because when they ask all these checklist questions, they will be able to do what is called a risk assessment. And that risk assessment will help them to know whether somebody is of high risk of contracting that virus, low risk, or medium risk. Now, for those that are low risk, usually they just ask them, they may not ask them to do anything. But for those that have medium risk, they will ask them to isolate. And then for those that have high risk, they will ask them to isolate and also have testing. Medium risk and high risk, most times, if they are frontline health workers, it is advisable that they have tests. So what are the two different type of tests? I'm sorry, the time is fast running. So there are two types of laboratory testing, the antigen and antibody. What is common now? We're all doing antigen testing. The antigen testing is like taking swabs, like it is shown here, from the throat and the nostril, the two nostrils. And this is taken by the officials of Ministry of Health. There are designated centers in Ibadan here. There are centers in UCH, Adeoyo, Jericho, many communities where people can walk in and go and do the test. And the test is free, according to what I learned. Now, there is also antibody testing, but I must say that the antibody testing is not yet acceptable in Nigeria, but I'm aware they do it abroad where they want to be sure whether if somebody had the infection is already mounting an antibody response, so that they will be able to know whether the person can go back to work. And when the person is going back to work, they know the type of advice to give the person. that whether it's at risk of a second wave of infection or is not. Now, in terms of the radiology diagnosis, it can be X-ray or it can be by way of a CT. Now, this is how the sample is collected from the nose, from the throat, and then this is the X-ray. On the side where I wrote normal studies, how normal X-ray looks like. You can see the lungs is dark, and then for the person that has COVID-19 has what we call ground glass appearance. The lungs has whitish patchy opacity, and if they have that, they will strongly suspect that the person may have COVID-19. Now, what are the public health intervention? Like I said, the first important thing is to do a case investigation. If somebody presents to the hospital with the symptoms of COVID, then the surveillance team takes it up. They do what is called case investigation. This is where I'm appealing to people that people need to be honest and sincere and know that what they are doing is an act of patriotism, and if you want to put it in the religious context, an act of ibadah, because when you are trying to protect other people, that is also an effort. So, and after you have given this information, they now start to speak to each of these people and notify them that this person, because a notifiable disease. And then after that, when they have done they've done the notification and categorization of risk, whether it's low risk, high risk, then they need to be supported. This support in Nigeria, how it is done is that if somebody has coronavirus infection, is known to be positive, initially when the disease, when it first started, they were encouraging everybody to go to isolation centers that has been prepared by government. But we know that our health system is fragile and there are a lot of things that we do not have. For example, how many ventilator machines do we have in Nigeria? We don't have more than like 300 for over almost 200 million people. Whereas in one state in the United States of America, they have ventilator in excess of 20, 30,000. So, so we do not have uh, this facility. So because majority of the people have mild infection, so government is now encouraging people to do what is called self-isolation. But let me throw a note of caution here. Self-isolation is only possible in a place where you have a room and a toilet facility for yourself. If you do not have, if you are living in a normal Nigerian type of accommodation called face me, I face you, it may be very difficult to do a self-isolation there because when you come to the corridor, you'll be having contact with people and you may just be infecting everybody in the house. So in that situation, I would advise in such individual, if you do not have a room to yourself that has toilet facilities, privileges. I was speaking to someone recently. I said, if you're on isolation, they just have to speak to you as behind the door. So behind the veil. So they cannot come to your room, you cannot go out. And you have to be there for a minimum of 2 weeks or until you are negative when they will come and do the test again. Now, usually somebody calls every day if one is on isolation to ask question, how are you feeling? You do a checklist of questions to be sure whether you are developing symptoms that may warrant the person to come to the hospital, or they will just encourage. So that it is what is expected. Now, so what I've described is what is called self-isolation, or some people call it. Now, for those that have contact, but they are not tested, they may do what is called self-quarantine. Self-quarantine means, yes, if you have had contact with someone and you have not done tests, and it shows that you have medium to high risk, the best thing is for you to also isolate yourself. So you begin to monitor yourself at home. You check your temperature, you check your saturation level, there is small pulse oximeter. And if you notice that you are now developing temperature or you are coughing, then you call the dedicated line, and they will either initiate treatment while you are still on your self quarantine, or you are going to be invited. They will come and pick you by the government official to an isolation center. Another people that you also need to do self quarantine are people that, as a part of policy, people that travel from abroad. When they come into the country, you remember that some of them were initially given a 5-star treatment. They were lodged in an hotel. But when government discovered that it's not sustainable, what they are now doing is that they are asking people to do isolation in their house. But I learned that, well, what I gathered is that before they leave their country of origin, they will have done a coronavirus test. And then when they get to Nigeria, because they must have been inside the aircraft together with people for a long period of time, they still need to do self-quarantine. So I've talked about the contact tracing, what it involves, and of course I've talked about what is a close contact. Close contact is somebody that is you are together within 6 feet and you are together for at least 15 minutes. Then it is a significant exposure that if one of you is positive, then the other person needs to be either tested or self-quarantine himself for 14 days. So I've talked about this. Now, I'll just briefly run through this treatment. It's just for us to have an idea of what is done there. It's not that I'm giving a free consultation online, just to have an idea, because many of us will be wondering, this isolation center that people go to, what is being done there? Or if they say somebody is on self-isolation, he was positive before, now he's negative. What have they done to the person? And unfortunately, people have also not discussed it. It is shrouded in secrecy as if they are doing something. And that's why different people are coming with different formula of treatment and claiming success, even though they did not do any trial. So treatment can be by itself at home when you are in self-isolation, or at a public institution if the person is symptomatic or has other complications. And the general principle for now is to boost immunity. So high strength of vitamin C has been shown to boost immunity. B complex, then zinc is given because it has been shown that people that have low zinc in their level in the level of their blood are more susceptible to the virus. So they give zinc and then also vitamin D3. And this vitamin D3, why it's this is one of the theory why some people have said we have low infection rate in Africa, because we are exposed to sunlight, we get a lot of vitamin D. So, but it has been shown to be beneficial. People have tried chloroquine, but from the current evidence, it has been shown, although we're taught in medical school that chloroquine has some effect, it has anti-malaria effect, it has antiviral effect, it has antipyretic effect, it has anti-inflammatory effect. So chloroquine has been used for so many things. They use it for treatment of rheumatoid arthritis, they use it for treatment of malaria, they use it for, so because of antiviral effect, some people have tried it. Yes, in France, they said they get good results, but in other parts of the world where these trials were done and that were even coordinated by WHO, it has been shown that chloroquine is not beneficial. However, there are some drugs that are used for HIV treatment, which has now been shown to have some effect. Again, the effect is not conclusive because the trial is still going on. So we are eagerly waiting for the outcome of this trial. And another drug that is given is Citromax. This Citromax is an antibiotics. And the reason is that if somebody has a viral infection, you do not want to have another infection over it. Otherwise, it will be double jeopardy. So because of that, Citromax is given to prevent any superimposed bacterial infection. And emerging evidence also show that for those that have severe disease, they are given dexamethasone in the hospital. But I must say that, please, I learned from my pharmacists who are my friends that a lot of people are coming to buy dexamethasone. Please don't abuse steroids. Steroids has deleterious effect on the body. When you use too much of steroids, it suppresses your adrenal gland, and perchance, if somebody wants to go and do surgery, recovery is usually very turbulent for people that are on long-term steroid. So please, we should not abuse steroid. Now, if somebody has had cough, I had low chest infection, pneumonia, and things like that, chest physiotherapy by blowing into a balloon, like the type of big balloon we buy for our children. If you blow into it, it's also been found to be useful because when you blow into it, it opens the lung alveoli and help the lung to work properly. And then, of course, in the hospital, they treat the underlying effect. So how do we prevent coronavirus infection? The first is to watch what we eat. Um, we like calorie here. It is good we take calorie, but we must be taking a lot of vegetables, a lot of grains, fruits, vegetable, ewedu, like our governor said, and fish, different things that could give us high protein and vitamins. And of course, personal hygiene has been overflogged, and we need to continue to emphasize this. Washing of hands when we use toilet, when we go out, when you are coming in, the first thing is to wash your hand. When you want to eat, you wash your hand before and after. And then the issue about avoiding overcrowding has been shown to be also useful. Now, the question is, do we do physical distancing or social distancing? I think it's physical distancing. We should not do social distancing. During this period, a lot of people have neglected their family because of coronavirus. They say, we're staying in our house. But staying in your house does not mean your phone is not working. So you should still connect with people. You should do social distancing because everybody is emotionally affected now with this virus. And we should talk to our parents, reassure ourselves, give ourselves hope that things will be well. And for those that have it, we should also not abandon them. If you have seen somebody that have survived it, they will tell you that one of their greatest moments, period where people check on them on phone. You can call people. You can call them, send prayers to them, say nice things to them. And of course, we should take a lot of fluids. Dehydration also make one to be more predisposed. And of course, exercise is very, very important. The exercise, because many of us, we live a sedentary lifestyle now. We eat in our room, we watch television in our room. Sometimes, because we now don't go to masjid, we pray in our room. So that inactivity can also affect us. So we need to move around. We can jog in our compound. We can do some moderate exercises in our room with our family members. So this is very, very desirable, and it's keep the body and soul together. What are the misconceptions? The misconception is that the origin is still controversial. Recently, I read that even people, religious leaders are saying that It is a wrath from Allah that maybe because of the sins we have committed and what have you. Yes, they may be right to some extent, but the infection is real. And because we now say it has religious connotation, does not mean we should not observe the public health warnings, i.e., by keeping physical distancing. For example, a lot of people have been misconstruing this to say that, oh, we have to turn back to our God and pray. And therefore, they'll go to congregational prayers, they will not use masks, they will crowd themselves together, and um, people will in the process spread the virus. So we we must understand that for such type of messages, they are just using it in a context to also tell us that we need to be prayerful and have our recourse to our God, but not necessarily saying we should abandon the public health. I must say that a lot of people also believe that COVID is a scam. In fact, I was shocked when 2 days ago when they conducted interview, even for people in Abuja, where the the center of power is located. In communities around Abuja, a lot of them believe is a scam when they were interviewed on the TV. And so, therefore, we need to enlighten people. We have family members who are not aware. We should tell people about it, tell them on how to prevent themselves from having it. Because when they have it, the little resources we have to eat and take care of our family, we will have to spend it if they develop any complication. Now, of concern is even this misconception is not only in Africa. In the US, about 3 or 4 days ago, I was listening to CNN and they also mentioned about COVID party. COVID party is there are young people in the United States who believe that also that coronavirus is not real, and they feel that they want to have a sense of how people that acquire it have it. So they will go deliberately create a party within an enclosure. So people that have it, that didn't have it, they will go there and have party for a long period of time. They will now be monitoring themselves. Did you develop any symptoms? Then some people that have it, that have the virus, will deliberately go to a gathering and stay there and see. He wants to know how many people may contract it. So they were testing whether the transmission, human to human transmission, is real. And these are young people. And there are incidences because if somebody has a coronavirus, if let's say A has a virus, if he's giving it to B, it can be detected in the lab via what we call genome sequencing to know, okay, it is A that gave it to B, not B that gave it to A, because they will look at it on the phylogenetic tree. They will see which of the two samples is older in terms of the lifespan of the virus. So they can know. So you can see that adventure, and because many of the people that are not affected are young people. So these young people are flaring it up. And you see in some states, they'll be recording 16,000, 17,000. So a number of cases per day. So I hope and pray that this type of misconception will not be brought into Nigeria, and that this is a wake-up call to Nigeria that we need to quickly preempt it. But I must say here that many of these social centers are clandestinely operating at night. And I think government also needs to do something about it in terms of their surveillance, their enforcer. When they should go around at night and see. You say that mosques and churches should not open during the day, but the clubs and lounges and all these social event centers are opening at night. And you see cars parked everywhere. And of course, government is not doing much about that. So the other thing is that we also need to be very careful about what we use. There are a lot of formulations. People are saying you should use turmeric, you should use atagigbe, you should use this, you should use that. But please, we should know the content of what we want to use. I've said it. We do not have a drug that can kill the virus now. Everything everybody is doing is to make sure your body is in the right shape. Immunity, ensure that you do not have infection, you do not have your nose is not blocked, steam inhalation and things like that. But please, we have to be very careful from collecting materials that we do not know what constitutes it, how to use it, and we go and use it, and then people come down with different complications. And when they now go and test them, they did not even have this virus to start with. So we have to be very, very careful about it. So the cheap, in terms of the one that has been shown to be very beneficial after personal hygiene is the use of mask. Again, here, I want to also advise us. If we want to use mask, we should use it well. Use the mask by ensuring that we buy the right mask. We should not use recycle mask. But if you want to use the mask that is made of clothes, when you wear it, you should have multiple of that. I would suggest you have one or two, so that when you wear it one day, you wash it and iron it before you wear it next time. Because when you wear it and you keep it on the door, on any surfaces, you can pick this virus and then you'll be inhaling it. In fact, you may just be, it may just be that you are the one that's even um, acquiring, I mean, creating a platform to acquire this virus yourself. So we have to be very careful. And then when you wear it, it should cover the nose and the mouth. You see some people, they will put it to cover the nose. You see some people, they will cover the mouth. You see some people, they will put it under the chin and they will be driving. If you are driving and you are alone in your car, you can remove your mask, put it by your side. When you get to a place where you want to talk to people, wear it and then talk to the person. If you are feeling choked, remove it again when you are alone in the car. So this is how it is stated. But some people have also said, oh, why is it that our president is not wearing mask? Because I need to say that a lot of people have asked me questions. You will see that every time that people go to him, every other person is mandated to wear mask, and it's a two-way thing. The only thing is that he can drop droplets, but you cannot give it to him. You cannot give it to him. And because he's practically on isolation, because he's inside the house, he's not going out, and virtually everybody that is using mask is with him. It's quite different from other countries of the world where their own presidents go around not wearing mask. I'm not sure our own president has left the villa since this has started. So we should not, because a lot of people compare these two together. So they are two different things. Now, this is where the final talk. The goal, the overall thing that everybody is looking forward to is to develop a vaccine. You see that many, for people that travel abroad regularly, when you go through before winter, they will say, go and have your flu jab, because they know that every time they have this flu, and a lot of people have respiratory problems, they could die. So when they have, and they do it in such a way that they remind everybody to have it. So so far there are about close to 150 vaccines that are currently being developed all over the world. And the idea is that when this vaccine is developed, everybody will have it, and then we'll be able to develop antibodies and develop what we call herd immunity. Herd immunity, H-E-R-D. Herd immunity is when you have immunity in the community to a level that it is now difficult for community transmission to happen. So, and most of the time, more than 70% of people in the community must have developed that type of antibody. And the only way we cannot say that we wait until more than 70% of people have the infection and develop enough antibody, that we are not sure. So the only sensible way is to develop vaccine. And alhamdulillah, a lot of vaccines have reached human trial stage now, about 17 of them. and it is showing promise. About 2 days ago, I think in New England Journal of Medicine, they reported success rate of volunteers coming for their second dose, and they are developing good immune response. So, and their target is that by end of this year, they should be able to do a community trial, the final stage of the trial, before they will license it and use. I'm also happy that even though most of these trials are happening in other parts of the world, the first African vaccine trial also commenced in South Africa, 1st of July. And I hope Nigeria will also join, even though when this started I think about 3 months ago, is a scientist in France was saying, "Oh, Africa is the best place to go and do vaccine trial, because in Africa they will have the infection. The infection is high. They do not have resuscitation. They do not have so that is, they will have raw patients to work with." And people took offense with respect to this by saying that Africa should not be turned to a guinea pig. But I must say that we need to participate in this trial, because if the vaccine work abroad, it's going to be based on assumption that it will work here. So we should also participate here, so that we are double sure that it will work with us, because some may work in a particular setting and may not work in another setting. And we have seen that with respect to vaccine. So I will end this presentation with some of these take-home messages. That coronavirus infection was believed to be a zoonotic infection, but there is now human-to-human transmission. There is no definite cure. Currently, the aim of the treatment at isolation center is purely supportive, boosting immunity, treating any symptoms, offering oxygen, ensuring that the person does not deteriorate, and of course, keep the person in the best shape until the person recover by himself or herself. Prevention and case definition is the most important in terms of how to mitigate against this virus spread. So we have to take responsibility, and the only way to take responsibility is we take responsibility for our action and inaction. I want us to take responsibility for our action by ensuring that we avoid overcrowding. We use all the preventive methods that our government said we should use. We should not say that the virus is a scam, and we should also make effort to educate people around us so that they will live well. And our hope is that sooner or later, the virus we will get a vaccine that will save all of us. May Almighty Allah make this talk a blessing for us and not against us. I'm very sorry that I took an extra time. This is where I will drop the curtain. Thank you so much.
We thank our professor, I mean, our